interest. There has also been questions planning to introduce face mask as a policy. Well, I mean, my answer to that is that we think that from next week, when we think we will have wrapped up production and distribution, we're going to be asking that face mask should compulsorily be worn at public places. This is part of the deliberations that we have had to go through extensively today. And I must say that we have commissioned over 1 million production locally from various tailoring companies and outfits that we have. And we intend to start distributing them in the course of the week. But we also must mention that people must not rush to now go and be buying the medical grade mask. The medical ones are for our medical personnel. And as you can see, myself and my other colleagues, we're not wearing any N90 face mask. We've started, rebranding ourselves to wear, the local made, which we believe will be adequate and sufficient and will meet, the spirit and the era of wearing face masks. The N19 and all of the medical medical masks are for medical personnel, and it is really to protect them whilst they are doing the very difficult job we have asked them to do for us. I think it's also important for us as a state to not panic, but to strengthen our resolve to continue to obey all our directives around social distancing, to continue to have what we call the respiratory hygiene, and to stay at home. What is expected of us at this time and what we should do, we certainly know it's not an easy sacrifice, but we must continue to employ you and to use the gentlemen of the media to continue to advocate to our people that this pandemic will blow over and that we can continue to guarantee and assure a sizable percentage of our citizens, you will get well, it will come in, but you will get well at the end of the day. In the last few weeks, you also remember that we had a few palliative measures that we announced, just so that we can have reasons for people not to feel the full brunt of having a total lockdown in our environment. We announced the palliative around ensuring that our medical secondary health facilities and some of our first-class primary health facilities are taking care of pregnant women, are taking care of health issues. And I did mention some of those statistics to you last week. Those numbers have since gone up, and we're indeed happy that people are using and are taking advantage of the facilities that were provided. We will also remember that we mentioned at the last briefing that we're starting our daily food kitchen program, which where we said we intend to feed up to about 100,000 youth. We'll also continue our distribution of food, the dry food relief, to our various communities. And one of the things we said at the last briefing was that we're doing the distribution with different stakeholders that we've identified. In the course of the past few days, we've had huge distribution amongst our various ethnic groups. We've given distribution to our various market associations, market men and women. We've had distribution at our tertiary institutions, religious bodies. We've had distribution with them. We've had distribution with some of our royal fathers and community leaders at their various locations. We're also having distribution with our university students, some of them that are staying in clusters that we know around the state, both the federal and the state universities and higher institutions. We're pushing out relief to all of them. And we're also passed on distribution to political parties in their formation. That also is going on. We also did mention that we're working on the data to clean up, so that we want to also do a cash transfer to the vulnerable and to the poor amongst us. That exercise is about to be completed, and like we've said, we're still committed to do a cash palliative to a sizable number of the people, the indigent people we have categorized in that category. I'm also pleased to mention that the daily food for the youth is going on very well. I must use this opportunity to thank both all of the host communities and most especially the donors. A lot of donors have partnered with us in this whole exercise. We've seen faith-based organizations coming up on a daily basis to partner on this Feed a Youth a Day that we've started, and the state government also is doing theirs. But a lot of individuals, a lot of NGOs, a lot of faith-based have also partnered with us, and I'm using this opportunity to thank all of them and to say that this is a collaborative effort that we're excited about, and let's just continue to push the corrective narratives. On security, you will agree with me that the situation has improved considerably in the last couple of days. And this was just as we promised with all of the security operators that were together last week. I'm in constant touch with all of them on a daily basis, and I can assure you that all hands are on deck, and we're sending strongest possible messages to people that want to foment trouble, hoodlums and bandits that want to seek to take advantage of the challenging times that we find ourselves. I'm aware that over 150 various people have been picked up, various criminals, and are currently being prosecuted as we speak. Our people must be able to go to bed with their both eyes closed. Every law-abiding citizen must continue to enjoy the guarantee of safety in their homes and neighborhood. But as for the criminal elements, there will not be any rest for them. As I said in my last address, there is no room whatsoever in Lagos State for anybody of criminal intention or criminal mind. The patrols and the show of force will continue day and night, and suspects will not only be arrested, they will be charged to court appropriately. I must also thank the DIG Moses Ogunyowo, who the Inspector General of Police had sent to us to help patrol and harmonize our border and our interstate with Ogun State. I think the officer has come with a lot of experience, and they've brought additional special force that we have seen, and I've met with them, and have gone to complement the Lagos State Police Command. I must thank them and thank the Inspector General of Police for this. We'll continue to give all of our military, intelligence service, the Civil Defense Corps, the Lagos Neighborhood Watch, and all other private security agencies all the accolades they deserve, because each and every one of them are working collaboratively amongst themselves. I think it's important to also mention at this point that later in the week, for our Muslim faithfuls, they will be commencing the observance of the annual Ramadan period. I know that we're all eagerly looking forward to it, but my appeal is this: even in our service to Almighty Allah, that let us continue to obey the laws and the guidelines of the land. As we prepare to observe this Ramadan period, we have a responsibility to continue to maintain appropriate level of respiratory hygiene and physical distancing, and observe the restriction on the permissible size at any gathering. We'll be very, very strict with the rules, with the laws, and with all of the directives we've given, and we would expect that everyone would comply. We still insist that any gathering that is beyond 25 is not acceptable, regardless of whatever circumstance we find ourselves. And I know and I believe that even as we go to worship, we will know and understand that these are very difficult and very trying times for all of us, and we'll expect to see full compliance. Dear Lagosians, as I end this address, let me once again touch upon the issue of fake and unverified news. I would like to implore us all that we should refrain from sharing news and reports that have not been verified or that seek to cause fear and danger amongst us. We all have an important role to play for not disseminating or amplifying these fake messages. We must also seek to share information that have been issued by appropriate health authorities. Let me remind us, just as the government has a responsibility to its citizens, we as citizens also have a responsibility to government. At a time like this, the most important of those responsibilities include obeying the directive and guidelines that must have been made for the entire safety of our citizens and for our well-being. As unpalatable and disruptive as a lockdown might be, it is necessary for us. It is also a way to prevent far more disruptive and devastating social, economic, and security scenarios. We are making this sacrifice today to avert possible disaster tomorrow. We have done additional 1 week out of the 2 weeks that have been prescribed by the federal government, and I want to implore all of us that what is in front of us is not up to what is behind us. Like the commissioner did explain, Commissioner for Health, at his press briefing yesterday, we're looking at a strategy of flattening the curve. And so we are all doing a good job. And what we're seeing is that we'll see spikes, but we're seeing that the curve should be flattening out soon, right? But that is not to say that we'll be out of it in 1 week or 2 weeks or 3 weeks. Various other strategies will be coming up as we go along, in the weeks and the days to come. Let me once again appeal to all of us, whether we might be in the state, to please stay at home and avoid non-essential movements. Let us continue to obey the rules and regulations that have been set and been put forward by both the security operatives and our health workers. I want to thank Lagosians. I want to reassure all of us that this will certainly fly over. We've been in this for about 6 weeks now, and I know clearly that we've all gone through this. But what we are seeing now is also a strategy to be able to enter all of our local communities. We've been able to touch over 1 million households already in the last week and a half. And that is what has brought out, so that we can clean up all of this once and for all and leave no one behind. And that's why we're ensuring that we're doing knock day to day, knock on every door, and those difficult questions are being asked. And we've had to decentralize, the turnaround time for you to get samples or for you to get tested. And so we're believing that once all of these are done, the plan for us to get out of this will all be achieved, very, very soon. Thank you very much. And we're just open for a few questions. Thank you.
Thank you very much, sir. Because of the press, we'll take just 3 questions. I hope we can synergize our questions and make sure those 3 people take all questions that will come from everybody. Do not touch this mic. I will help you adjust it to your height. Thank you very much.
Good evening, Your Excellency, and everybody. Can you hear me?
Yeah, we can hear you now.
Okay, good evening, Your Excellency, everybody. I want to talk about people who tell lies.
People
who tell lies. People who tell lies about their travel history or their symptoms. Is there going to be some sort of penalty? Because they are endangering not just themselves and their families, but everybody in the country and beyond, because of the way COVID-19 is so easy to spread. Will there be some punitive measures? Just as an example. Then, it's really alarming to see how many cars come out each day. Even today, there was traffic on the way coming. And I'm wondering, where is everybody going? Can we rectify this? Is there any way that people can be convinced, encouraged to remain in their houses beyond what has already been done? I know a lot has been done, but people need to stay at home. Then, finally, you spoke about going through about 1 million households. There's an active case search now. There are sampling sites and everything. Is this likely to get worse? Talking about people who are positive for COVID-19 before it gets better. Thank you.
Good afternoon, sir. My name is Dayo Jerinde. I write for Punch newspaper. I have 2 questions for the governor and 2 for the commissioner. For the governor, the first question I would like to ask borders around hazard allowance for health workers. A lot of health workers I've spoken with said they are dissatisfied with what they get.
They are what?
Dissatisfied. They're not satisfied with what they get. Some people told me that they get as low as 5,000 per month as hazard allowance. Is it not the time for the state to increase the hazard allowance for health workers to motivate them at this trying time? Then secondly, sir, resident doctors at the Lagos State University Teaching Hospital treating COVID-19 patients.
What?
Resident doctors
Yes.
at the Lagos State University Teaching Hospital.
Yes.
That are exposed to treating COVID-19 patients, please stay and live in the community. Do you have a plan of building a residential apartment for them within the hospital?
I don't get the question.
Resident doctors
Yes.
at last rather,
Yes.
still stay and live within the community. Many of them are exposed to COVID-19 patients. They treat them when they come. Is the state having a plan to build residential building for them within the hospital? To the commissioner, the sample center so far, how many samples have been collected and how many of them have been tested? How many samples have been collected in the sample centers and how many of them have been tested? And finally, on the death of the late chief of staff, on Saturday, the commissioner tweeted that he died at First Cardiology Consultant Hospital in Ikoyi. I called the hospital and they denied ever having him in the hospital. I want to ask,
And
at
what?
what point I called and they denied having him in the hospital.
Okay.
So I want to ask, at what point was the late chief of staff brought to First Consultant Cardiologist in Ikoyi? That's the question for the commissioner, sir.
Okay.
All right. Good evening, Mr. Governor. My name is Shoyi from Yola today. I report for Lagos Television. My first question here is about the local production of the face masks you just mentioned that is going to be rolled out before the end of the week. Now, my question is, how effective are these local face masks rather, to ensure that it curtails the spread of this virus we are talking about? And the second one is that we see some pockets of young men that are trying to secure their vicinity now, probably because they noticed a lower presence of policemen in the environment. Now they gather to protect the environment. What are we putting in place to ensure that this doesn't scale up to something that constitutes a nuisance after COVID-19 era? Thank you.
Can we respond?
Yes, you can take this set of questions, and we have the language.
Okay. Thank you very much. Thank you very much, Mary. The first question was around what are we going to do? People telling lies. I think it's a very, very serious matter, and it speaks, to conscience, to the depth of our conscience as human beings, as Nigerians, as people that speak to the dignity of what we truly believe in. We have taken a decision coming out of even this meeting that we're actually going to be prosecuting people. We are going to make 3-4 people scapegoats and examples, because it's not only unfair, you're also risking the life of other health workers who, if you don't say the truth, there was no way for them to know where you've been, who you've been in contact with, and what your previous life history or health history has been. I think it's only when the full arm of the law, touches a few, right, that they will know that it's a very serious matters that we're talking about. But it also has a flip side as well too. Is also just to ensure that our health workers to also heighten their level of suspicion, right? To be sure that once they suspect any, they certainly would raise the alarm and ask that such patient be transferred or calls be made for us to come and pick up such patient. But I think it's an important point you raised, and I think it just speaks to the value that each one of us holds, as an individual and as a person. And there is no better person than you, gentlemen of the press, to make this a conversation in our community, to make this a very serious indication that it's not a time where people need to joke, about who they are not or who they are. We all need to come, not 98, not 99, but 100% sincere as into what you know about yourself. But like I said, we are going to prosecute a few examples. In fact, we are working on 3-4 names already, and that we're going to make examples, and we're going to publish and publicize such names. Traffic, what can we do? I think it's all of us taking responsibility. All of us taking responsibility, and we've expressed this in so many ways. Twice I've spoken to the Commissioner of Police today. Short of the governor himself going on a co-bridge to begin to apprehend, people that are not meant to be on the road. It's just unfortunate, and there's nothing that we've not done to get people to understand and appreciate that this is a little sacrifice that we can do for our tomorrow. It's a little sacrifice that we can do for ourselves. If you are not on essential service, if you are not part of people that have been exempted because you have an essential or an important assignment to do, you need not be on the road. Part of the things that we've also said with the traffic officers and the police is that the checking time too, whilst they've had to constrict, from 4 lanes to 3 lanes or to 1 lane, right? Their checking time to ascertain who you are and what you're going to should be fast, so that it doesn't tail back and constitute, a half-kilometer traffic, to the back, so that they are not unduly asking questions that are not important. Once you've been able to show your ID card and where you're going to, they should flag you and go. Not to now be asking what is in your boot, what are you carrying, and all of that. So that is the information I've also passed on today. And those are the 2 things that are causing it. Will it get worse before it gets better? That's a very direct and very simple question. But the commissioner too will still speak to it. If I must answer directly, it will get worse before it gets better. Because what it means is very simple. We want to flatten it once and for all. We do not want to have a spiking move up and down. So that's why we're knocking on doors. That's why we've had to decentralize sample collection to all of the local communities and all of it, because we know that it is now in the communities. So we need to come and get everybody out tested and ensure that once they're tested, we also can get treated and clean out of the system. So yes, it might get worse before it gets better. But once we have a strategy around it, life can still go on if we have a mechanism that is working around it. Dio asked a very tough question that I'm not sure where that is coming from. And it's not true. Where is Dio? That's not true. If some people are just passing information loosely to you, your responsibility is to do investigative journalism and find out what is the correct position. There is nobody, and I repeat, there is nobody that is in our front line that is on a COVID-19 list of having been treating a patient that has earned anything around 5,000. The least person, if I dare say, will have earned 20,000. In fact, we've even doubled that. Even for drivers that are driving, they are not even earning 20,000. The last allowances that I gave, drivers were earning 40 and 60,000. So it's not true. But however, what that person probably will have told you is that before COVID-19, in their normal pay structure, maybe there is an allowance called hazard allowance that they were earning 5,000 naira. I don't know. Because if you are in Ibejuleki or if you are in Alimosho and you are a normal health workers and you are not under the COVID first line of respondents, right, you are not part of the people that have given allowance to. But however, since you have asked it, because I've also increased their workload this month, there's a plan that I'm also going to increase their individual allowances for this month for every of our entire health workers, in respect of if you are on the front line of COVID or if you are just treating somebody that has malaria or somebody that has a cut in his leg. So that I'm sure will put, an end to that. But it's always very easy for people to just throw numbers at you. It's not true and it's not what we're doing. Okay? And it takes me to the next question, which you also said, which is why, as a journalist, let's be very investigative. So when you say that I must build accommodation for lawsuit doctors because they are treating COVID-19. First is that lawsuit is not designated as an isolation center. It's a teaching hospital, right? So it's not. But however, it's not to say that a COVID-19 patient might not come in. But it is not an isolation center. It's not a treatment center for COVID-19. Secondly is that I cannot go out and build a residence or build accommodation in 2 days or 3 days. To build accommodation is 2 years, is 3 years. So if a resident doctor has told you that they need accommodation, this is not the line to use to get accommodation. We have a program, we have a plan to meet all our people. And they are not, because they are resident, they are not treating COVID-19. They are treating their regular patient as a teaching hospital. But like my sister Mary said, in the event that the patient now comes in lying about who he is or what he has, then that is what triggers the suspicion. And once we identify and see that it's a COVID-19, it goes to a COVID-19 treatment center, which we have at the isolation centers. Thank you very much. What point was the late chief of staff brought to Ikoyi? Well, we have my heart and my soul goes to the family of the late chief of staff. We usually have a saying: a dead man, let the dead man bury and sleep well. I think it's not fair for us to now make that a cause of conversation. When did he come in? When did he not come in? It's sad enough that we've lost. We do not want to lose anybody for this pandemic. We do not want to. So now begin to find out, the hospital, the Honorable Commissioner had said, is being given certification before this event as a COVID-19 place where we can have high-end sensitive treatment. It was well qualified. High-end sensitive treatment. And it's been so. And I did mention in my speech that there are lots of other private hospitals that have come forward to be so designated. And I said that a farmer currently as we speak is recertifying some of them. So maybe it was just a wrong person that picked the phone and they got scared. Maybe the way you asked them the question. Thank you. Local, my friend from TVC, local face mask, how will it cover, will it protect? There's been several literature and there's been several schools of thought around face masks. You realize that it also took us a while for us to also, the face mask from the literature and what we understand is truly really to protect you from infecting others. Is to keep whatever is with you, to keep it to yourself, so that you are not passing on what you have. You want to sneeze, you want to cough, you want to do anything, you are not expelling it anyhow. So it's really to protect you. So it's really to protect others from you. So in truth, you are the vulnerable that you should protect yourself from infecting others. So that's why we must ensure that public places now, everybody gets to protect himself from infecting others. And the ones that are medical, of surgical masks are the ones that will be reserved for the health workers alone. And that's why we've pleaded that people should not rush to go and buy the N95 or the medical face mask. We have several levels of, you've seen it on social media, several levels of wearing face masks. People have been very ingenious about it. It's really just to hold whatever is with you to yourself, and you're not infecting others. And I'm sure the commissioner can still say one or two things, about that. You also mentioned something around people protecting themselves in their local community, and all of it. I certainly must assure Lagosians and all of our residents that government will not abrogate its responsibility. We have seen improved level of security in this massive, big mega city in the last couple of, and we intend to keep it. We intend to make sure that our citizens' life continue to remain safe. However, if a community decides to have additional measure of security, we will not unduly restrict them from doing that. But government will not shy away from its own line of responsibility. We will not abrogate our line of responsibility to anyone. We will continue to provide those first line security operatives to our citizens, and will continue to ensure that the entire city and the entire state remains safe. If it demands that we increase the number of paramilitary or parasecurity operators that we have, if it demands that we continue to have conversations with the President, with the Inspector General of Police, we will continue to have that. And that's why in the last week or so, they've also helped us by bringing additional men, into our security architecture, and we're indeed happy and we're grateful to them for doing that. There's one question. What was the question? Well, if you have a number, yeah.
He asked questions about how many.
Yeah, he will answer.
So we have been increasing our testing capacity in line with the strategy to try and identify as many people in community with COVID-19, which is one of our strategies. Last week, or the week before the last, we tested a total of 400 samples. And this immediate past week, that testing capacity went up from 400 to 1,400, demonstrating a dramatic increase in our capacity to test. And we can go even further. We're hoping to run at least 2,000 to 3,000 tests in the coming week as we embark on the active case search in the community. Of course, as we test more, we're likely to see more positivity. We already know that the virus is circulating in community, and the more we look for it, the more we'll find. But that is in keeping with our strategy. The more people we can bring into our isolation facilities who have been identified as positive for COVID-19, the less the virus can spread, the flatter the curve will be, and the more capacity we'll be able to throw at this outbreak. At this same time, in Europe and in the United States, at the same time from their index case, Europe and America were seeing thousands and thousands of cases. We are still around the 500 mark, which indicates that our curve, even though it's growing gradually, is indeed very flat. It hasn't peaked. We expect more cases, but it's the rise in cases that's the important factor. We want a gentle slope and not a steep slope. So our strategies that we're doing in terms of isolation, containment, social distancing, and active case searching seems to be paying off for us in Lagos State.
Orúkọ tèmi ni Adéyẹmí Adésànyà, mo ń jábọ̀ ròyìn fún iléeṣẹ́ Bond FM 92.9. Ọ̀pọ̀lọpọ̀ ohun tó làmìlaka lẹ ti sọ ní èdè Gẹ̀ẹ́sì, ṣùgbọ́n mo fẹ́ kí ẹ yọ̀nàná bí méjì ní èdè tiwantiwa. Ẹ ṣàlàyé pé nítorí pé èèyàn bá ní àrùn COVID-19 ò mean pé àbí kò túmọ̀ sí pé èèyàn ti gbọ́jọ́ kú. Mo fẹ́ kẹ́ ẹ tún ṣàlàyé ìyẹn lédè abínibí. Pàápàá Ramadan tí ń bọ̀ lọ́nà a dẹ̀ mọ̀ wípé àwọn mùsùlùmí lọ́pọ̀ ìgbà wọ́n máa ń nífẹ̀ẹ́ láti kóra wọn jọ. Ẹ ti ṣàlàyé lédè Gẹ̀ẹ́sì ṣùgbọ́n mo fẹ́ kẹ́ ẹ ṣàlàyé lédè abínibí ohun tí ìjọba ti là kalẹ̀ láti lè mú kí wọ́n ṣe ohun gbogbo tó yẹ kán ṣe ní ìbámu ìlànà èyí tí ẹ ti là kalẹ̀ fún.
Another question? Ẹ ṣé gan ni o. Inú mi dùn láti tún bá wa sọ̀rọ̀ ní ìrọ̀lẹ́ yìí lórí gbogbo akitiyan tá à ń ṣe nílùú Èkó láti rí i pé a kẹ́sẹ̀ àrùn COVID-19 a kẹ́sẹ̀ kúrò ńlẹ̀. Ní ìta ti rí bí ọjọ́ mẹ́ta mẹ́rin sẹ́yìn a rí i pé àwọn èèyàn tí wọ́n ti ní àìsàn COVID-19 yìí nílùú Èkó àti nílùú wa Nàìjíríà ó ti lọ sókè sí ìdí tó dẹ̀ fi lọ sókè ó pẹ̀lú àwọn ìlànà tá a gbé sílẹ̀ pé a fẹ́ jẹ́ kó rí i pé gbogbo ibi tó bá ń fojú pamọ́ sí pátápátá la rí ká má jẹ́ pé a kàn ń fi ìtọ́jú a kàn fi ń bo àìsàn yẹn a kàn fi ń bo lójú ni la fi di pé à ń wá káàkiri àti ń wá à ń kan ilé sílé àdúgbò sádùúgbò gbogbo àwọn local government wa làwọn òṣìṣẹ́ wa náà ti ń lọ káàkiri tó ń béèrè pé báwo lẹ ṣe ń ṣe sí o ṣorí ò fọ́ yín jù ṣé ẹ wúkọ́ jù ṣé àyà ò dùn yín jù báwo ló ṣe ń ṣe iṣẹ́ tá à ń ṣe ní àwọn àdúgbò yẹn ló fi jẹ́ ká fi rí i pé àwọn tí wọ́n ní àìsàn yẹn wọ́n pọ̀ sí bó ti yẹ kó tẹ̀ rí nìyẹn nítorí à ń wá káàkiri ni kó má dà pé bóyá ó ń farapamọ́ síbi kankan ló fi jẹ́ pé à ń lọ láti ìlúgbò sí ìlúgbò àti ilédélé àti àdúgbò sádùúgbò a ti dé bí 1 million àwọn ìbòbí tá à ń gbé láàrin ọ̀sẹ̀ kan àbọ̀ sẹ́yìn a dẹ̀ máa ṣe lọ bẹ́ẹ̀ ni títí tá máa fi rí dájú pé àìsàn yẹn bó tiẹ̀ jẹ́ pé ó ga sókè ṣùgbọ́n kò ga ju nǹkan ká lè wòsàn lọ bàdẹ̀ ìfẹ́ tí ń sọ fún wa ni pé àìsàn yìí kò ń ṣàìsàn pé tó bá wá sílé àìsàn ilé tá ti ń wò wọ́n sàn tá ti ń mú wọn dání pé àwọn èèyàn ò jáde ẹ rí i pé àwọn tó ń jáde lójoojúmọ́ wọ́n ń pọ̀ sí ni nítorí ẹ̀ ni pé àwọn èèyàn ń gba ìwòsàn ara wọn dẹ̀ ń yá wọ́n dẹ̀ ń lọ́lé bó tiẹ̀ jẹ́ pé àwọn lára wa náà ti ìṣolóògbé ó máa ṣe ní láàánú ṣùgbọ́n kò ń ṣe àìsàn tó jẹ́ pé bóyá gbogbo wọn àwọn èèyàn tó bá dẹ̀ ti ní no máa ń di pé bóyá wọn nílé wo ara wọn sàn wọ́n wo ara wọn sàn ni àdẹ̀ ń wò wọ́n sàn àdẹ̀ ń dúpẹ́ pé wọ́n padà sẹ́nu ilé wọn wọ́n padà sí ilé wọn àti àwọn ẹbí wọn èyí tó máa jẹ́ kókó nínú ọ̀rọ̀ mi lọ́sàn-án yìí ni pé kẹ́ má jẹ́ kí kabẹ̀ tó bá sọ fún wa pé ìyá bàbá ó dà pé àìsàn yìí ti dọ́dọ̀ kẹ́ wá ká wá sọ pé kò ń ṣe tèmi mo tarí ẹ̀ ká kò ń ṣe bẹ́ẹ̀ sà pé it's not my portion ẹ jẹ́ ká gbà pé bó ṣe rí nìyẹn nísìn láàrin ọ̀sẹ̀ kan sọ́sẹ̀ méjì tẹ́ bá dẹ̀ ti wá sí àwọn ilé ìwòsàn ó di dandan pé ẹ máa padà sí àwọn ẹbí yín àti àwọn ará yín kò ní dá kẹ́ wá jókòó sílé kẹ́ wá fi àìsàn yẹn tó wá fi kan àwọn ará ilé yín la fi ń bẹ̀bẹ̀ la fi ń tọrọ pé ẹjọ́ tó Ọlọ́run kò ń ṣe àìsàn pé èèyàn lè báyàn ṣe mọ́ ẹni tó bá ti lọ tó ti jáde ó ti ti dára wá padà nìyẹn kò ń ṣe nǹkan kan wọn ní ààbò kankan lára wọn ní àìsàn kankan lára wọn ti parí ẹ̀ ó ti lọ ó ti jáde lára kò sí nǹkan kan mọ́ ọmọ yín ti dọmọ yín padà ní ọkọ yín ti dọkọ yín padà ní ìyàwó yín di ìyàwó yín padà ní màmá yín di màmá yín padà ní so irú àrò yẹn la fẹ́ kẹ́ sọ fáwọn èèyàn pé kán jọ nítorí Ọlọ́run tán bá ti ní pé wọ́n wá mú wọn pé kán wá fara pamọ́ sọ́dọ̀ wa kán gbà pé ara tó fẹ́ fi pamọ́ yẹn wọ́n á padà sílé wọn láìpẹ́ jọjọ. Èyí tá a dẹ̀ tó wá fẹ́ sọ níbẹ̀ ni pé má fi ara kàn mí, dúró sáyé tiẹ̀ kí n dúró sáyé tèmi. Ó ṣe pàtàkì ká máa ṣe é lọ. Ẹ̀yin oníròyìn wa, mo fẹ́ jẹ́ kẹ́ polongo ẹ̀ dáadáa, àti ní rédíò àti ní tẹlifíṣọ̀n. Ó di dandan tó máa ní ká jókòó lé, ẹ jẹ́ ká jókòó. Jíjókòó lé ta fi ń jókòó lé yẹn ni pé tó bá wà kò èèyàn rí lójú. A dẹ̀ tún wá gbé ìmọ̀ pé a fẹ́ máa wọ mi ò mọ ìbomú tèmi náà tí mo gbé símú yìí, a fẹ́ máa wọ̀. A ti bẹ̀rẹ̀ sí ẹ rí pé eléyìí àwọn télọ̀ lọ́balẹ́lẹ́ ló rán, àwọn náà rán fún mi. A ti ń bá wọn sọ, wọ́n ti ń ran tó máa pọ̀. A máa fi fún, a lè fún gbogbo èèyàn lu o, but a máa fi ránṣẹ́ sí gbogbo àyíká káàkiri, àwọn ìyá ọlọ́jà, àwọn bàbá, a máa fi ránṣẹ́ sí gbogbo yín èyí tó bá lè dé, àti ní kàn máa eléyìí tẹ́ bá ti wọ̀ ni pé ẹ ní àǹfààní láti jẹ́ pé nǹkan tó bá wà lára yín ẹ tún gbé fẹ́ lòmíì. So kò ṣe pé bóyá ẹ̀yin ò tún lè fi ran ẹlòmíì. A sọ pé nǹkan kan wà lára ẹ̀yin o, but oníkàkú tọ́jú nǹkan tó wà lára ẹ̀. Lágbára Ọlọ́run gbogbo adẹ̀ ni la máa yẹ o, kò ní sí wàhálà láàrin ilé àtọ̀nà wa. Èyí tí arákùnrin wa tún sọ pé kí n tún bá a sọ ni ìta máa ń ṣe lọ́dọọdún tó jẹ́ ọdún Ramadan tí àwa mùsùlùmí ta nífẹ̀ẹ́ púpọ̀ jùlọ lọ́dọọdún, ta dẹ̀ máa fi ń bá Ọlọ́run sọ̀rọ̀, ta máa fi ń bá Ọlọ́run ní gbólóhùn ní bí ọgbọ̀n ọjọ́ ta máa fi ń ṣe yẹn. Ó tún ti dé tán bí ká tó parí ọ̀sẹ̀ náà ni pé a máa bẹ̀rẹ̀. Ṣùgbọ́n ìmọ̀ràn wa ni pé ẹ tó ń ṣètọ́dún yìí á ṣètọ́dún tó ń bọ̀ lágbára Ọlọ́run. Tó o bá lè ṣètọ́dún yìí bó ṣe máa ń ṣe tàwọn ọdún tó ti kọjá, lágbára Ọlọ́run á dẹ̀ sí wàá ṣètọ́dún tó ń bọ̀ láyọ̀ àtàláfíà. Tó bá ní pé tẹ bá fẹ́ túnu o gbọ́dọ̀ lọ mọ́ṣáláṣí kẹ jókòó kẹ pọ̀, túnu lé ẹ̀ gbàdúrà, kó tẹ́ ẹ ní ẹ sílẹ̀, kó tẹ́ tàfi ń gbàdúrà, kó gbàdúrà ẹ̀. Ọlọ́run náà gbàdúrà. Ṣùgbọ́n Ọlọ́run ló ń ṣe fún, kò ń ṣe pé ó fẹ́ kán rí ládùúgbò pé ó wá ó ti gbàwẹ̀ o, mo ń gbọ́dọ̀ rí pé mo á túnu. So gbogbo ìta ti fi sílẹ̀, àìmá máa bá òfin yẹn lọ náà ni o. A lè kóra wa papọ̀, a lè kóra wa jọ pé ńgbà táwa fẹ́ sọ́pà fẹ́ lọ túnu, àbá fẹ́ ta máa ń lọ gbàdúrà láàárọ̀ táwa fẹ́ jí sáré, pé a lè ṣe gbogbo ẹ̀ o. Ilé la máa ti máa ṣe o. Tàbá dẹ̀ fẹ́ lọ sí mọ́ṣáláṣí, a gbọ́dọ̀ make sure pé mọ́ṣáláṣí wọn ò ju àwọn èèyàn ta ní pé gbọ́dọ̀ wà, a dẹ̀ gbọ́dọ̀ fúnra yín ní ààyè. Ọlọ́run náà á gbàdúrà wa o. Ọlọ́run náà ẹ rí pé bó ṣe ń ṣẹlẹ̀ ní gbogbo àgbáyé nìyẹn ní wákàtí. Àdúrà wa ni pé tàbá ṣe inú ilé wa náà, òun náà máa ní àǹfààní máa wà ń bẹ̀. Tọ́ba dẹ̀ du ọdún tó ń bọ̀ lágbára Ọlọ́run tí gbogbo ilé bá ti kásẹ̀ ńlẹ̀, tọ́ba yẹ pé ká tún fara kanra ká tún jọ ṣe ni, Ọlọ́run á fún wa ní àyè náà láti ṣe. So ẹ̀yin lóyìn wa, ẹ jọ̀ọ́ ẹ bá wa mú délé, ẹ bá wa mú dínà pé gómìnà sọ pé àdúrà yẹn àti ìgbà síwájú, ṣùgbọ́n Ọlọ́run á dúró ti ilé àtọ̀nà gbogbo wa. Ẹ ṣé gan ni o.
Thank you very much, Mr. Governor. Permit me to say this is not only a very brilliant set of response,
Thank you.
also succinct and explicit. Thank you, gentlemen of the press. Have a wonderful day.